Good morning. It's Wellness Wednesday, and how fitting is it when we just got to celebrate Valentine's Day this week that it's also Heart Awareness Month or American Heart Month, and it's so fitting for it to be during the month of love, Valentine's Day. And I thought I'd bring it up today because so many of us think about grandparents being older, maybe age over 65 or 70, that's when we have to start thinking about heart disease. And the truth of the matter is, we need to be thinking about it in our 20s, in our 30s, because that's when the groundwork is laid upon how our nutrition is, how our cardiovascular system is. We need to know what our blood pressure is running. And so I thought I'd bring it up today and challenge you all to just think about your cardiovascular health. What are you doing right now? Being overweight is a risk factor for early heart disease. For us as women, our numbers and our risk of heart disease really doubles after menopause or during menopause. Think about those hormones. We've been talking a little bit about hormones. They're actually protective against heart disease, and that's why we see that increase when we go through menopause as we lose some of those protective hormones that slow down that aging process. A lot of us think that we age faster when we don't have hormones on board, and that's so true. So what can you do today, no matter what age group you're in? Well, you can ask for an extended cholesterol or lipid panel. Unfortunately, in this insurance-driven world, they usually just pay for a plain lipid panel. Well, it doesn't give us the whole picture. And so you can ask your physician if you can have an extended lipid panel where they kind of break up that cholesterol into the smaller pieces and look at some risk factors that you might have, like the ApoB genetic mutation or genetic marker, whatever you want to think about, that. So there are some certain markers that we can test for, like a homocysteine level or a C-reactive protein that is cardiac specific. There are lots of different labs that we can order. Majority of them are covered by insurance, and especially if you have risk factors, those can be run through your insurance. And if not, we can ask for a cash pay price. It's amazing how sometimes the cash pay price is cheaper than what your insurance copay would be. And so get aggressive. Maybe that's not the right word, aggressive. Get proactive and ask if you can have some of that blood work to see where you're at, because knowledge is power. And those are numbers that you can follow. What about oxidative stress? Have you heard of that term? Now, there's not a great test for oxidative stress, but there are multiple tests that we can do to see if you have an increased risk of oxidative stress, which is the root cause of disease, no matter if it's heart disease or, the aging process. And so we can follow those. And guess what? There are things that we can do to reduce that number. We have tools to do that. And it's not always a medication. A lot of the times it's lifestyle modifications and certain supplements that have been known to decrease the inflammation naturally in our bodies. And so I am challenging you to, look at your blood pressure, look at your cholesterol panel. If someone tells you don't start treating your blood pressure until it's over 140 over 90, that's wrong. There's damage that's happening already. So get aggressive. Know what your blood pressure is. Know what your insulin resistance is. Don't wait till you're a diabetic until you start discussing what you can do to decrease your blood sugars. Are you a pre-diabetic? Do you have insulin resistance? There are tests that you can do to see if those terms are part of your history. Get proactive so that you can activate your health. Don't wait till you start having signs and symptoms of disease. We want to prevent it from even starting or progressing. So with this month being Heart Health Month, think about that. What are things that you can be doing with your practitioner to find out where you are on the spectrum? And you can start as early as in your teens and 20s to just be aware of what things can do to slow down that aging process. Check your blood pressure, check your cholesterol, check your insulin level, check some of your inflammatory markers, and have a healthy diet. I'm going to pop some people's bubbles here when I tell them that Cheerios and oatmeal are not the best things for you to do in the morning for a heart healthy. How they were able to get that label was because they had fiber, and we know that fiber helps. And so carbohydrates do not, especially refined carbohydrates, but fiber, and you can find fiber in your complex carbs, like quinoa and brown rice. You can get them out of your vegetables. They have fiber in them. Increase your vegetable amount during the day. How about just adding flaxseed or sprouted hemp seeds? There are lots of different ways of getting fiber in your diet. So that is incredible. So are your cruciferous vegetables. They're incredible too. They have something called sulforaphane in there. And there are so many different vegetables with phytonutrients to help and really help your body out. So let's get more details. Let's have an extended conversation. Let's do things that are considered out of the norm so that we know where you're at. And there are testing that you can do that's non-invasive too, like a calcium CT score. Those are great if you're starting to have some of those risk factors, or you have family heart disease and you want to know that risk factor. We can run that test. You can ask for that. So let's have a detailed discussion. Don't wait for disease to happen. Know your family lineage, know your numbers, and let's put a plan together to keep your heart healthy. And remember, your emotions make a huge difference too on how your heart ages. And your cardiovascular system depends on you being active. So even walking every day is good for the heart. You don't have to go to the gym for an hour to exercise your heart. It can be just simple walking, jogging, being active during the day. So I hope that you have learned something today, that I've challenged you to be heart healthy and pass this on, because our hearts are incredible. They beat every second of every minute of every day, and we need them to be strong. And it's the muscle in the body that we don't want to have enlarged. We want to have it just perfect. And unfortunately, in the past 2 years, we've had some issues with heart, whether it's broken heart, whether it's heart that has been affected by a virus or a vaccine, and we need to figure out what our heart health is. So take advantage of February being Heart Awareness Month. Get in touch with your practitioner. Let's figure out things that we can do to protect it and activate it so that it is there for us for a long time. Because if you're like me, and you've heard this when I've lectured, I want to grow old kicking and screaming, meaning I want to have an incredible active life. I want to go out with a bang and be active so that I can play with my grandchildren and my great-grandchildren for as long as I can. So have a blessed day. See you next week.